and welcome to today's webcast, Hard to Treat, Scalp, Face, and Ear Psoriasis. My name is Bev Bromfield, and I'll be your moderator for today's presentation. Before we start, I'd like to go over a few items so you know how to participate in today's event. We've taken a screenshot of the attendee interface. You should see something that looks like this on your computer desktop in the upper right corner. You've joined this presentation using your computer's speaker system by default. This means if you hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, select Use Telephone in the audio pane, and the dial-in information will be displayed. You'll have the opportunity to submit questions to today's presenter by typing into the questions pane on the control panel. You can send your questions in at any time during the presentation. We'll collect these and address as many as possible during Dr. Bagel's Q&A session. Before I provide information about the foundation, I'd like to acknowledge and thank our sponsors, Celgene and Novartis, for their support of today's webinar. Since some of you may be new to the foundation, here's a little background about who we are, our mission, and what we do. In 2014, the National Psoriasis Foundation developed a strategic plan which drives everything we do as an organization. To achieve our mission, the following goals were identified: accelerate discovery to cure psoriatic disease, improve health outcomes, achieve goals to help reach our mission, whether it's being involved with an event or becoming a volunteer, about psoriasis and psoriatic arthritis, and a better understanding of what it means to live with psoriatic disease. If you have psoriatic disease, you can help accelerate efforts towards a cure and a greater understanding of the disease by participating in the NPF Corona National Psoriasis Patient Registry, which is the largest independent observational registry of psoriasis patients in the U.S. This registry represents a network of dermatology clinics that collect and study patient health information, allowing researchers to compare the safety and efficacy of psoriasis treatments, better understand conditions that are related to psoriasis, and explore the history of the disease. You can share your experience with researchers about what it means to live with psoriasis and psoriatic arthritis by participating in Citizen Scientists. Answer questions and view your data along with over 4,000 participants. Data is used to help researchers gain a better understanding of the disease. To learn more and participate, visit the websites listed on the screen. We continue to improve health outcomes through our Patient Navigation Center, the world's first personalized support center for people impacted by psoriatic disease. The Foundation's Patient Navigation Center is available to help you find physicians, treatment information, navigate insurance issues, access support through our one-to-one program, and more. Contact us at 1-800-723-9166 or visit psoriasis.org/navigation center. To achieve the Foundation's goal as mentioned, please support our mission through donations or by participating in local Team NPF events near you. You can learn more at psoriasis.org/donate or teamnpf.org. On behalf of the National Psoriasis Foundation, thank you for attending today's webinar, where you'll learn more about the prevalence of scalp, face, and ear psoriasis and its impact, what therapies are used to treat scalp, face, and ear psoriasis, and tips for speaking with others about the impact of symptoms on quality of life. Now I'd like to introduce you to our speaker, Dr. Jerry Bagel. Dr. Jerry Bagel is a nationally recognized expert in the treatment of psoriasis and has been practicing dermatology and dermatologic surgery for almost 35 years. Given his dedication to the treatment of psoriasis, he established the Psoriasis Treatment Center of Central New Jersey in East Windsor. Dr. Bagel is regularly invited to speak across the country and internationally about psoriasis and its treatment. He is active in clinical research and has been an investigator in over 100 clinical trials designed to find new treatments for psoriasis and other skin conditions. Dr. Bagel is a member of the National Board of Directors for the National Psoriasis Foundation. He is also a 4-term member of the Foundation's Medical Board and a President's Council member, which represents an elite group of healthcare providers committed to the mission of the Foundation in finding a cure for psoriasis. It is my honor to welcome Dr. Bagel, who will present information and strategies about managing scalp, face, and ear psoriasis. Please welcome Dr. Bagel.
Thank you, everybody. As you can see here, I've been involved with many different pharmaceutical companies in regards to clinical trials, consulting, and speaker. What I'd like to say is pretty much any pharmaceutical company that's been involved in psoriasis research, I've been involved with. So I like to say I'm heterogeneously conflicted. we're going to talk a lot about scalp psoriasis. So the most important thing from my perspective is we talk about severity of disease. And a lot of times people talk about, oh, you need to have 10% of your body surface area or more to consider that severe, with 1% being the palm, the size of your hand. But, you can have psoriasis of your scalp, and that, by definition, might be 3% of your body. But if you look at this has a major impact on the quality of your life. You're itching, you're up all night scratching, you can't sleep, you're bleeding, you are not going to wear a black dress or a black suit, you're embarrassed, and many people come to my office having used multiple topical therapies. And in fact, it's very difficult to use topical therapies in scalp psoriasis because of compliance and getting into the hair and getting out of it. And I've been very aggressive and put them on biologic agents because it seems to work better than anything else. So I am very aggressive in treating scalp psoriasis. As we see in the rest of the body with scalp psoriasis, it's very similar. We get raised, red, scaly, very well demarcated plaque. It could be in a little part of the body of the scalp, or it could be the entire scalp. There's a lot of flaking and scaling and itching. Sometimes it can result in some hair loss, but that isn't all that common, and it's hard to treat because of all the hair that's involved with topical therapy. When we look at the severity, it's called the Psoriasis Scalp Severity Index. We look at how indurated, how scaly it is, how red it is, how thick it is, and how much of the surface of the scalp is involved. And you can see here how much of even it goes beyond the scalp onto the neck and onto the ears. Obviously, we're going to try the safest medication first, and the safest would be topical therapy, which we could use mild topical steroids, we could use steroids in oil, we can use steroids in foam, we can use steroids in lotion, steroids in gel, we can use really strong steroids, we can use mild steroids. Sometimes they work, many times they work for a while, and then compliance becomes an issue and people are tired of using it. So then we could go over to phototherapy, ultraviolet light, or laser treatments to try to get in the scalp. It has some benefit, but again, it's difficult to get into the treatment, into the scalp area with those modalities. We can use some new oral medications and also biologic therapy. There are many different shampoos that we can get over the counter. For instance, Neutrogena T-Cell shampoo is probably something I recommend 10 times a day or more, because I have people put the shampoo in their scalp for about 10 minutes before they shampoo it out, because the salicylic acid helps eat away the scale, and that allows for whatever other topical steroid you might put in to work better by penetrating more easily into the epidermis and then into the dermis where the pathology of the psoriasis lies. There are medicated shampoos that are actually also prescription cortisone shampoos like clobetasol shampoo, which has really benefit mostly to decrease itching. It doesn't really help as much with the psoriasis, but it helps with itching. Sometimes we use interlesional Kenalog, cortisone into the scalp. That can help somewhat as well, and all these combinations we can mix and match accordingly. We can also use tar. Tar shampoos can decrease the proliferation of the epidermis, and therefore tar shampoos can be utilized in the treatment of psoriasis from the scalp as well. Remembering that you need to always use the tar shampoo and leave it shampoos in for about 5 to 10 minutes. People may not like the way the tar smells, so they may not want to use it. A trick would be just wash it out with another shampoo and another conditioner afterwards. You can always use other shampoos and conditioners after you've applied the other medicated shampoos. This is something you have to be very careful about. They talk about plaque removal. Well, trauma induces psoriasis. So the scratching that one does in the scalp actually induces psoriasis. This was discovered by a Dr. Kebner in the 1870s in horseback riders in Berlin, Germany, when he realized there was an increased aspect of psoriasis on the inner aspect of the legs of horseback riders, and it's now known as Kebnerization. So one could warm the scalp with lukewarm water and gently remove the scale, but I'm telling you, you better be very careful, because otherwise you're going to actually exacerbate the psoriasis. I'm not a big fan of it. When you're washing your scalp, you want to be very gentle with it. You don't want to be rough with it. You might have to take an antihistamine at night to stop the itching. Medicated shampoos could really be very helpful, as I mentioned. Shampoo here before applying prescription topicals. People ask, oh, when do I put the medication on? Well, obviously you put it on after you've shampooed your scalp, because if you put it on right before you shampoo your scalp, you're going to wash it right out. And then you could use conditioners. There's a medication called DermaSmooth FS. It's a little cumbersome, but it's a cortisone in peanut oil for those of you that are not peanut allergy. And you can wet your scalp with water at night, dampen your scalp, put the DermaSmooth FS in, wear a shower cap to bed. If you don't like it, you can maybe do it for 3 hours before you go to bed, and then wash it out with a medicated shampoo. That helps get rid of a lot of the scale, and then you won't have to use the medication under occlusion, and you could probably titrate down to medication that's a lot easier to use. There's also non-steroidal medications that have some benefit. I think the vitamin D derivatives, calcipotriene, especially in Enstellar foam, because it's a combination of a vitamin D, natural vitamin D, and a moderate potency topical steroid, so not really that strong, but the combination is very effective in the treatment of psoriasis. Taclonex Scalp is a very similar product. Dovanex, Sorolux, as monotherapies, I'm not a big fan of calcipotriene. I think you really need to utilize them in combination. Tazorac is a vitamin A derivative of a new medication just came out recently called Duobri, which is a combination of Tazorac and halobetazole, which could be very effective for scalp psoriasis. And in addition, Lexit, which is a stronger topical steroid, halobetazole, which you could apply twice daily for 2 weeks, can be very helpful in the treatment of scalp psoriasis. Again, there are very many different types of topical steroids. Betamethasone is like a class 2. Clobetasol is much stronger, so you might only want to use it for 2 weeks because it can result in thinning of the skin, although we don't really see that often in the scalp. But if you got into the ears or into the neck or face, it could. And also, if it got into the face, it could result in acne. Dexamethasone, that's a spray and there's also Clobex spray that can be utilized in the scalp as well. This is something that you start with a really stronger topical steroid, and as patients start doing better, you bring it down to a less stronger topical steroid. In addition, like you might do some things twice a day for a while and then bring it down to just at night for a while, and if you're doing well, might just do it 2 times a week for a while. See how well people do. Intralesional steroid injections, they don't hurt nearly as much as you think, can be very beneficial for localized plaques in the scalp that do not respond to topical therapy. Phototherapy, we've utilized phototherapy for almost 100 years for psoriasis of the body, but to get it in the scalp, you really have to have special devices that can part the hair and get right into the scalp. Now, there are some home phototherapy appliances that work, but what I find that works the best is actually excimer laser, because with psoriasis can take a lot more light than normal skin, so you can go to a lot higher dose twice a week. It doesn't take 10 minutes. Really, with the newer systems, it takes 30 seconds, and then you can get in and out really quick, twice a week, 5 weeks, 6 weeks, and really make your psoriasis go away very safely, no increase in skin cancer. Excimer laser can be very effective. About 10 years ago, there was an oral medication approved called Apremilast, known as Otezla. It's an oral medication. People like it because there's no blood test monitoring, there's no increase in infections, no increase in malignancy, there is a little nausea, there is a little diarrhea, but it tends to decrease over time, and it has some benefit, but as you can see, about 40% of people do well. Not 80, but 40. So therefore, it might be worth a shot in some individuals who have not responded well to topical therapy, but are not interested in going on a biologic agent yet. As you can see here, the data shows that Apremilast works about 46% of the time. Patients achieving scalp PGA response, really of 0 or 1. That means they're clear or almost clear. So almost half the people are clear or almost clear in 16 weeks, compared to only 17% in the placebo group. Treatment options also, methotrexate, cyclosporin, oral retinoids. We don't use much anymore for the treatment of scalp psoriasis because of the risk factors of methotrexate of liver toxicity, cyclosporin, kidney toxicity, and oral retinoids. You do not want to use in women of childbearing age because they'll have abnormal babies. What we have been using a lot are biologic agents. TNF inhibitors like Enbrel or Humira or Cimzia, IL-17 such as Cosentyx, Taltz, or Siliq, IL-23 inhibitors like Stelara, and more recently the IL-P19 inhibitors, Ilumya, Skyrizi, and Tremfya. And what we see, they're all been done in clinical trials, and we see even in Etanercept, which was one of the earliest biologic agents, 2004, we saw that within 12 weeks there was an 86% improvement in the scalp, and within 24 weeks, 90%. With adalimumab, 93.8% achieved improvement, two-thirds complete clearing. You're not going to get this with topical therapy. Having said that, with biologic agents, some of them, like the ones I just mentioned, there is an increased risk of serious infections. You have to monitor for tuberculosis. Those are some of the risks because they're immunosuppressive. Cosentyx has been FDA approved for about 5 years, 90% improvement by 12 weeks, 35% completely clear. So this is remarkable significance. And you can see over here, 52%, 56% people within 12 weeks that are clear. Over half the people will be clear taking these shots. You take a shot at week 0, 1, 2, 3, and 4, and after that you take 2 shots every 4 weeks. You can see some of the pictures here, baseline, over here 12 weeks later. Taltz, it's also an IL-17 inhibitor. You can see here that about 80% of people have improvement in psoriasis severity, scalp severity index, and almost 3/4 are completely clear within 1 year. And you can see here, not only is there complete clearance, 71% people are clear at week 12, there's a maintenance of that response through week 60. So it's not just working for a little time, it's working for a long period of time. Tremfya has been FDA approved for 3 years. This is one shot at week 0, 4, and then every 8 weeks. 81% people achieved significant improvement. 2 out of 3, again, complete clearance. So you see significant benefit from the biologic agents. 83% of people at week 16 were clear or almost clear of their psoriasis after 3 shots, week 0, week 4, week 12 of Tremfya. There's other treatments. These are all already FDA approved at this point. Siliq is a biologic agent. It's also an IL-17 inhibitor. That's called brodalumab, has effectiveness in scalp psoriasis. Ilumya and Skyrizi are also like IL-23 inhibitors, P19 inhibitors, administered at week 0, week 4, and then every 12 weeks. You can see here that some of this drug in particular, Skyrizi, 75% of people got 90% better at 16 weeks. 80%, 4 out of 5 got 90% better after 52 weeks. And in fact, over half people cleared and stay cleared. So that is scalp psoriasis, which I feel we treat very aggressively. Facial psoriasis, on the other hand, I believe many, many times responds well to topical therapies, but you have to be careful about the strength and the potency of the steroids that you use, because otherwise you can thin the skin out. You could also get acne. You can't use really strong topical steroids or even mild for a prolonged period of time around the eyes, because if you get into the eye over a long period of time, you could increase the risk of cataract and glaucoma. So you have to be very, very careful. But I think when used judiciously, one can utilize topical therapies more effective in the space than in the scalp, partially because compliance is not as difficult because you're not dealing with as much hair. So facial psoriasis, because the skin is thin, you can really utilize a lot of topical therapies that might not work in areas where the skin is thick. Now, what I like to do in addition to using a topical therapy is I often tell my patients to get, for instance, a gauze pad and put cold water on the gauze pad or lukewarm water, whatever is their preference, and have it soak on their face for about 10 minutes twice a day before using the topical therapy, topical steroid. This could increase the amount of topical steroid, again, that can penetrate into the dermis and help fight the pathology of psoriasis. In addition, we can use medication with topical steroids like MG217. That can be helpful. This is a good area where we can use some vitamin D derivatives without steroids, calcipotriene derivatives. They don't have any steroids in them, so they don't result in thinning of the skin. Sometimes there could be a little bit of irritation. We can use things like Protopic or Elidel. These are non-steroidal medications that work really well in areas where the skin is thinner, in the face, the groin, axillary area. They work really well. In other areas, the molecule's too big to penetrate through the thick epidermis, but in these areas, it works well. Ear psoriasis is really a hassle for many people because it can clog up your ear canal and make it difficult to hear. On the other hand, you don't want to go poking things in there like Q-tips and jamming more gel in there. You have to be careful. Like, again, I like warm soap. Or sometimes what I might do is, because it could be colonized with bacteria, I might use 1 part, hear me through, clear vinegar, 4 parts water, and soak for a couple minutes, then put on a mild steroid, and that could help really a lot get rid of the psoriasis in the ear, because you don't want to get it in the ear canal, because you could result in loss of hearing for a while, and you might require even going to a ear, nose, and throat doctor. So as with all the areas, whenever you have thick plaques, you want to soften them with lukewarm water. You might want to use mineral oil or even olive oil to soften the area up. And then you could maybe use a Q-tip very gently to remove the scale, and then use a topical steroid lotion, not an ointment, but a lotion, to really get it in there without clogging up the ear. As I mentioned as well, you can see how extensive this can be. You could use eczema laser on it. That would work. You could use any of these non-steroidal medications. You could Tazorac, I think, might be a little too strong and irritating here, but I think there's lots of different options that one could use. But if that doesn't work, biologic agents are an option. As I mentioned, once I said use Q-tips, once I didn't. I think if the ears are pretty clear, you can use some Q-tips, but until you get to that point, you better be very careful and maybe use a tissue with your fingers so you don't go all the way in. We know that all of these areas can result in a decrease in quality of life. We know that when you go to the beach, you have psoriasis on your body, you're going to want to avoid going there because you're embarrassed. You're going to want to avoid going to the hot tub, not want to be seen in public. You don't want to have flaking all over. Even at home, it's going to be a decrease in quality of life because you're embarrassed, and other people are going to be cleaning up after you, and you're going to feel terrible, and some people are going to feel like they're dirty and there's something wrong with them. But that's not true. I think what you really need to do is communicate with dermatologists who are interested in taking care of psoriasis. The truth is, some dermatologists are more interested in treating psoriasis than others. You want to find out who is taking care of a lot of people with psoriasis using biologic therapy, having phototherapy, having laser therapy, that has all the bells and whistles at their disposal so they can help you with any type of psoriasis that you might have, and they feel comfortable in all the different aspects of treating psoriasis. So, closing comments. When you go to your dermatologist, first thing, bring all the stuff you use. Even if it's a big bag, they'll go through it and they'll throw away some of the stuff. No good, no good, no good, go good, good. And they'll figure out what worked for you, what didn't work for you. It's really important, whatever you used, either topical, oral, biologic, you go there and you let them know how long you were on it, if it worked or not, if you had any problems with it, and that will really help the dermatologist determine what the next course of action will be. Because if you told them you used topical therapy 3 or 4 times, that dermatologist give you another topical, you'll probably go to the next dermatologist after that. They're going to want to know what you really used. They're also going to want to know possibly what other parts of the body you have it, that you should be showing them your entire body. They're going to discuss with you or bring up if you have psoriatic arthritis or symptoms of psoriatic arthritis, because that may lead to a different type of treatment. I think one of the biggest problems of psoriasis treatment today is what happened about 30 minutes ago. There were 3 psoriasis commercials. 2 of them basically say, I have psoriasis, my life is terrible, I went on this new medication, I did well, but I could die of cancer or in serious infection. There is an increased risk of infection in these medications. In the newer ones, actually, they're better, more effective, and actually safer than what we saw before. So although we do have to be careful and judicious, I think that why they say that there's these risks is because they have to claim whatever these medications were used for. For instance, if they were used in rheumatoid arthritis and they were used with methotrexate and with systemic steroids, that does increase the risk of infections and malignancies. But truth be told, when you use it as a monotherapy by itself, those risks are not nearly as great. And I think people are more scared of the good treatment than they really need to be. So those are my closing comments. I did this in a little quicker than I thought, so I can answer more questions than I thought I could. So bring them on.
Thank you, Dr. Bagel, for such an informative and helpful webinar. You had a lot of great tips to share with our attendees today. We'll now start our Q&A session. If you have any additional questions, please submit them through the question panel on your attendee interface. We'll attempt to answer as many as possible in the remaining time. The first question asks, do the biologics have a healing effect on my scalp? I'm currently on Taltz.
Yes, healing effect, yes. The data shows about 75% of people get totally clear. Their scalp gets totally clear on Taltz within 12 weeks.
Another question, how long can I use a steroid spray or foam on my scalp before taking a break?
Well, it depends on the strength of the steroid spray, but somewhere between 2 and 4 weeks. But that doesn't mean you need to stop it altogether. You can then go to every other day if you need to, or on the weekends.
Okay, another question. I have been using my ointments for more than a decade already, and now suddenly all of my treatments don't work anymore. What are my options?
If that happens, I don't know how severe your psoriasis is, but if you have severe psoriasis, you can go up. If it's just for scalp psoriasis, you could start with excimer laser. If that doesn't work, you could try Otezla. Could do a biologic agent like any of them, Taltz, Humira, Silique, Tremfya. Biologic agents, they're all good. A lot of them are really good. Skyrizi.
What are my options if I have psoriasis on the eyelids in the nasal area?
On the eyelids, I would probably first go with something like Protopic or Elidel because they're non-steroidal. On the navel, you could use any type of steroid for a few weeks, even a strong one for 2 weeks. It wouldn't be a bad thing. And then you go to a milder one after that. You can start with clobetasol and then drop ointment and then drop down to triamcinolone. But for on the eyes, I'd probably use Protopic ointment to start with because it's non-steroidal.
How do you treat a face that is peeling around the mouth, nose, and forehead?
Well, peeling, again, I'd probably start by using a mild topical steroid ointment a few times a day so that the dryness would go away. And once I got the skin to heal, I'd go from there to a non-steroidal medication like Protopic or Elidel.
Okay, great. This individual indicates with recent surgeries, knees and hip replacements, my scalp psoriasis has gotten so much worse. How can I calm it down?
Well, first of all, it probably got worse because of the stress of the surgeries. First things you can do is maybe use DermaSmooth FS under occlusion. It's a prescription. You wet your scalp with water, and then you put the DermaSmooth FS in, wear a shower cap to bed, and then in the morning wake up, take the shower cap off, put Neutrogena T-Sal shampoo in it, shampoo it out, leave it in for about 10 minutes, shampoo it out, and then use whatever shampoo or conditioner you want afterwards. And I'm telling you, within a week, you're going to be significantly better.
That's good news. So this is for a teen who's under 18. I don't always get my mom and dad to help me apply topical medication to my scalp or head. Are there other options?
Maybe have mom and dad teach you how to do it. Have mom and dad do it, and then you do it, and then have mom and dad watch you do it and do it again and learn how to do it.
We've already spoken a bit about ear psoriasis. How do I treat psoriasis when it goes very deep into the ear canal?
I think the first thing you do is you use warm soaks on a gauze pad. And like I said before, you might want to dilute it 1 part vinegar, clear vinegar, 4 parts water. After that, there's things you can do, like you could use like an oil, like olive oil, and you can then let that sit in there for a while and let that, you could actually have light, warm olive oil, not hot, and let that soak in there. And then you could just gently move it out with like maybe a handkerchief or a gauze. And then after you do that, you can get a topical steroid lotion and you can put that in your ears.
We didn't really talk about natural products. Do you have any comments about what can be used in the ears or on the scalp? What supplements could help?
I think the best thing is eating well-balanced meals, avoiding fatty foods, don't drink too much alcohol or avoid as much as possible. Alpha omega can help. Eating more fish that's oily like salmon, mackerel. Stay away from red meat and milk products. Eat more of a Mediterranean diet. I'm more about food, about keeping your weight down. I'm more about getting rid of the inflammatory components of obesity.
Okay, and another question. This individual is indicating they have a daughter with Down syndrome and also using the biologics for scalp psoriasis, which is not getting better. Do you have newer biologics that you could recommend that are safe to use with Down syndrome?
All biologics are safe to use in Down syndrome unless the individual has cardiac issues. If the individual has cardiac issues, I would stay away from tumor necrosis factor inhibitors like Enbrel, Humira, Cimzia, Remicade. But the other ones would be like the IL-17s, Taltz, Cosentyx, the Tremfyas, the Skyrizis, the Illumias would be just fine.
You spoke about a few shampoos and conditioners. Can you tease out any of the best shampoos or conditioners that you would recommend for the scalp?
Conditioners are basically not therapeutic at all, so that's just a matter of how it makes your scalp feel. Shampoos, again, I'm talking about ones that have tar in them or ones that have salicylic acid in them or a combination of the two. And that could be, I know Neutrogena, I have no vested interest, but I've used Neutrogena for 30 years, and I know that's probably one of the better products that's available for scalp psoriasis.
This one is asking about psoriasis in comparison to eczema. Are the treatments the same?
No, these are two completely different disease states. Although you can treat eczema sometimes with topical steroids, you don't use vitamin D derivatives. The biologic agents that you use for psoriasis are completely different than the biologic agents that you use for eczema. The thing is, you can use topical steroids and you can use like Protopic and Elidel for the two, but other than that, they're very different. Eczema is a different type of disease of the skin. You have to treat it differently. It's much more itching. Even though psoriasis itches, eczema itches a lot more, so it's different. Also, eczema tends to get infected more, so you have to deal with the infections. And in addition to that, eczema, the skin gets worse in the winter. It needs a lot of moisturization.
Another question, how do I deal with hair loss with psoriasis?
Well, the best way to deal with hair loss in psoriasis is to be aggressive about treating the psoriasis. So if you're really getting hair loss, you might want to be much more aggressive in your treatment and go to a biologic agent to get your scalp psoriasis under control quicker. And that will help your hair grow faster. Because if you're getting hair loss from your psoriasis in your scalp is pretty severe. And I'm concerned that topical therapy is not going to work, and oral therapy is not going to work quick enough. So you better jump to a biologic agent.
Right, and how can I keep my psoriasis from leaving scars, or what can I use to eliminate scarring?
Psoriasis does not scar. That's a misconception. Psoriasis might leave you with little red patches. Psoriasis might leave you with little dark patches, but over time, they will fade.
That's good to hear. And the last question I'll ask, my son has repeat ear infections. Is this due to the flaking skin from his psoriasis entering his ear canal?
It's possible, and that he gets bacteria in there. It's possible. That's a question you're going to have to take up with an ear, nose, and throat doctor.
Thank you again, Dr. Bagel, for such an amazing presentation and taking time to answer so many questions. I'm sure those who attended today's webinar learned a lot of new information or tips to help manage their psoriasis on the scalp, face, or ears.
You're more than welcome. I appreciate the opportunity to help educate people. I think I was put on this earth to really help people with psoriasis, and I really hope that some people on the line got some tips that can help them with their scalp psoriasis, their ear psoriasis, and their face psoriasis.
You definitely provided some very useful tips, some of which I haven't heard before. So thank you, Dr. Bagel, for your presentation.
Right. You're welcome. Thank you. Good night, everybody.
If you're looking for hair products, lotions, or cleansers, please take a look at information provided through the Foundation's Seal of Recognition program at psoriasis.org/seal/product-directory. You'll find information about some of the over-the-counter products that Dr. Bagel mentioned. They are proven to be safe to use and effectively manage symptoms of psoriasis and psoriatic arthritis. In addition to today's webinar, podcasts are also available through Apple Podcasts, Google Play, Spotify, iHeartRadio, or a feed service of your choice. You can access current and past podcasts at the website listed here. Look for episode 26, which is about ear psoriasis, which was launched last Tuesday. Contact the Patient Navigation Center to receive a free flare tracker, or if you still have questions, would like additional information about treatment options, finding a physician, or are having issues with accessing treatments, contact our Patient Navigation Center by phone, email, live chat, or Skype. Once you leave today's webinar, you'll receive a survey to provide feedback about the presentation. Tell us what you think. We value and appreciate your comment. I'd like to again extend a sincere thank you to our sponsors, Celgene and Novartis, for their support of today's webinar. And finally, you can access our webcast archive at psoriasis.org/webcast. This concludes our presentation. Thank you for attending.